Hi, my name is Amber Green, and today we're going to be talking about hand washing and respiratory hygiene. The purpose of this topic is to educate the community about health and wellness. If we're not educated about proper hand hygiene and proper respiratory hygiene, we can spread unwanted diseases. For example, with COVID-19, now that we've learned that it's more like a flu, if someone, God forbid, were to have COVID-19 that was standing right beside me and decided to cough out without using proper respiratory hygiene, I would have a chance of catching COVID-19 because that is an airborne disease. It is a virus. So that being said, it's very important to educate the community about proper hand hygiene and about proper respiratory hygiene so that we can be educated and not spread unnecessary diseases. Step one for hand hygiene is you're going to want to get your soap into your hand. You're going to want to rub your hands together for about 15 to 20 seconds. You're going to want to rub it together. Rub it really good, get it in between the fingers, like this. Get the nail beds, because we don't know what kind of gross stuff is in there. Also, with hand hygiene, it's really important. We can even add more soap. It's really important to practice hand hygiene because we're constantly touching things. We're touching our face, our mouth, our nose. We're touching doorknobs. So it's really important. We're just gonna kind of lather it in there. Then we're going to wet our hands. We're gonna wet our hands, I have some makeup residue left over, so let's go ahead and see if we can get that off with the water. Now that we've done 2 layers of soap, great, no more makeup on my fingers. And we can even just shake dry. When are you gonna hand wash? You're gonna hand wash after you use the restroom. For example, I'm in the bathroom, I just used the restroom, I'm washing my hands, right? If I'm entering into the nursing lab after using the restroom, even though I just washed my hands, I'm gonna go ahead and wash my hands again because I just touched a doorknob and I'm about to interact with patients, which is another great example of when you want to implement hand hygiene, is when you're entering a patient's room. It doesn't matter if you've left for 5 seconds and you're coming back in, you want to go ahead and wash your hands. How do you want to wash your hands? How I demonstrated. You're going to want to use soap, you're going to want to use water, you're going to want to use paper towels, or an air dryer, or you can just let your hands air dry like me. It's important because when you wash your hands, you're getting all that bacteria off. For example, if you come in contact with C. difficile, which is diarrhea, that's actually not something that can be killed. Like those bacteria, the spores cannot be killed with hand sanitizer. It's only 99% effective. You actually need soap and water to get rid of C. difficile. So hand washing is so important. Secondly, we're going to talk about respiratory hygiene. This is about covering our mouths when we cough and sneeze. For example, that is improper respiratory hygiene. You're not going to want to cough out loud, like the example I gave in the beginning of the video. If I had someone with COVID-19 next to me and they were coughing like that, it would get me sick. So what we're going to want to do for proper respiratory hygiene is we're going to want to cough into our elbow. We're going to want to sneeze into our elbow because all the particles that are coming out of our respiratory airway are going to go into our elbow. And then if you accidentally cough in your hands, just go ahead, perform your hand hygiene again. It's important for health, it's important for preventing illness. If you have any challenges with hand washing, maybe you don't have any soap and water near you, what you're gonna wanna do is just keep a hand sanitizer bottle in your pocket. Then you can pull it out, squirt it in, put your hand sanitizer on, perfect. Your hand hygiene is set. And any respiratory hygiene challenges that you may have, a solution would be keep a tissue in your pocket and cough into that. Make sure you're doing hand hygiene after. Thank you.